How do I provide insurance, health insurance, for the people that work with me? It's a great question. This is Ron Wysokarski for Beach House Consulting, and I've got a few thoughts on how the heck we handle this insurance thing. Years ago, it felt impossible as a small business to provide health insurance for those that work with us. And we had a bit of a breakthrough a few years ago, and we formed a really small group, and we had an opportunity to at least offer health insurance. And it felt really good because we'd never been able to do it before, and I was really hopeful that it would benefit everybody that worked for us to become a great reason either to stay with the company or join the company because we had great health insurance. It didn't quite work out that way, and here's what happened. We absolutely had two great plans, and the prices were competitive, but didn't include every doctor that they were used to using. Some of the people we worked with were able to find it on their own through different sites. The same type of insurance with their doctors for the same price or less. And so even though we had what we thought was a pretty good plan in place, we were convinced it was a pretty good plan. The fact is that most people chose not to join in, not because they didn't want to be part of the company health plan. It just simply wasn't the best plan for them at the best price. What do you do with that? I've sat down with our people a number of times over the last 3-4 years that provide the insurance. What is it we can do? How do we compare the apples to apples, if there is such a thing? Is there a doctor locator identifier that, which doctors are on what list? The fact is the options have changed dramatically. So we had a couple of things that we could do. We can offer a stipend, if you will. A portion of their salary could be towards health insurance. And just say, listen, here's an allocation every month that goes towards the insurance. It can go towards your company plan or any plan that you want. And just pay it to them and then let them, figure it out on their own. And that's viable for a lot of the people that we work with. They're just more comfortable getting their own insurance. Let's face it, you get your own car insurance and life insurance and homeowners insurance. It's not a huge stretch to get your own health insurance. The company plan, we're doing everything we can to figure out what plans are available. Maybe we can switch a plan in or add another one or do something just to make it more affordable on a monthly basis. Now, it's insurance, there's risk. So usually when you're getting a better premium, you're sacrificing something, and it's usually in the form of a higher deductible or a different structure on the copays or maybe a different type of prescription benefit. Insurance is just risk. That's all it is. And you're paying some money to avoid a catastrophic loss or paying even more down the road. When you're paying $1,000, $2,000 a month for health insurance, you expect a really good plan. And it isn't always what it appears to be. One thing that a lot of people do not think about is you can go through the Affordable Healthcare Government site, and you may not qualify to get it for free or at a discount. But some of those plans are pretty good on their face value. So the curveball here is it was right underneath your nose. The best option might be just to go to the government healthcare website and to look at the plans as if you were a consumer that was paying the whole thing and not going there just to get it for free. What's interesting is some people have quickly dismissed that idea, are going back and finding that some of the plans in the portal are highly competitive to what they pay in the open market. Go figure. So, do I have a solution for you to provide health insurance, I should say, for all of your employees? Not necessarily. Who knows? And it could change. Might stay the same. I think the uncertainty is one of the bigger problems, and the time it takes away from your business to figure this stuff out is ridiculously long. Let's face it, we're experts in our own field of business. Most of us aren't experts in health insurance. It's painful, it's a tough process, we don't quite understand it, we get frustrated. Here we are, most of the way through November, and a lot of us are still trying to figure out what we're going to do with the plans. This is how it goes. I would say this, make sure that everybody is aware to check the government website to see if they can get a really good plan, even if they got to pay for it. Compare that to what you might offer them. The worst thing is to have a false benefit. Let's say that you offer a health insurance plan to everybody that works for you, and yet the cost for them is so exorbitant that they couldn't take advantage of it no matter what. I'd almost rather not have a health insurance plan than to have one nobody could use. And that's what a lot of us are facing right now. I don't have all the answers, but I know a lot more of the questions to ask when I go into these meetings. So if you want to know more of those questions, or you just want to comment below and let me know what you think about this, please do. Definitely subscribe. This is Ron Wojciechowski for Beach House Consulting.